I like to run very long distances, anywhere from 30 to 100 plus miles, and I like to run them in the mountains. So I do ultra marathoning and obstacle racing, Spartan, Ultra Bees, things like that. I get a physical every year, and I get told every year, you're my healthiest patient. Elevated PSA level was the first sign that I had an issue. And so I had an MRI, it showed a lesion on the prostate. I knew I was in trouble. It really does play with your mind in a sense, because you think you're bulletproof, you think you're indestructible. I was at a point I needed a biopsy. I did not want to have a TRUS biopsy and had learned about perineal biopsy. And at that point then, I went to Dr. Brisbane for the biopsy.
Andy came to see us at UF Health because he was very interested in a transperineal approach. The reason why transperineal biopsy is excellent for many men is the way we're doing it involves 2 imaging systems, so the accuracy is phenomenal. And it allows you to get a biopsy where we visualize the needle going through the tumor. So it's about as accurate as you can get. There's also fewer side effects, so about 0% risk of sepsis, especially compared to transrectal. And then it also opens the door for some other treatment options and planning for focal therapies. Because we don't put any biopsy needles by the neurovascular bundles, there's at least a theoretical benefit. It's not causing as much erectile dysfunction if you're having multiple biopsies.
And so once we got the results back, and they were disappointing, so they removed the prostate. I recovered quickly. I got back to training within weeks for my competitions, and I recently had my blood work done, and there was no sign of cancer. Go with the perineal biopsy. There is no reason not to. It's a better procedure, it's more accurate, it's fast and easy. We can either fold up shop when we hit our challenges, or we can take the challenges on. And I was just happy that I had great support from my wife and family and from UF Health. And it's always a team effort.